Well, yeah, it's unprecedented in Scotland. I think we're 3 times higher than any other European country in terms of drug deaths. So it is a critical national emergency, now far more of a public health emergency than coronavirus. And this might have been the first time since 2013 that we've not seen an increase in the drug death rate in Scotland, but it's still 5 times up in the mid-1990s levels. So we have a severe structural problem, a fairly exceptional structural problem in Scotland with drug-related deaths. And there are many reasons behind that. Very intensive deindustrialisation. If you look at the most deprived areas in Scotland, you're 15 times more likely to die of a drug-related death. So there's a very difficult situation there about multi-generational structural poverty that needs to be dealt with in a more holistic way. But we have to first and foremost try and keep people alive. And that's why I've brought forward a bill to the Scottish Parliament, a member's bill, that intends to licence what are known as overdose prevention centres. And there's over 90 of these operating around the world. And there's most recently been a pilot undertaken in New York. There hasn't been a single death recorded in relation to these, but they have prevented thousands of deaths by supervising, preventing and reversing overdoses, particularly in relation to opiates such as heroin, where you can then readily administer the antidote, which is a drug known as naloxone, to very readily reverse an overdose of heroin, very similar to an EpiPen or something similar to that. You can even now use it as a nasal inhaler. So they're very easy and straightforward ways to save lives, and this is a very ready and practical way to do it. And we had an unofficial pilot undertaken in Glasgow by an activist known as Peter Crikent, and I was helping him out during the pandemic. And we saved 8 lives in Glasgow and reversed 9 overdoses just amongst us volunteers doing it unofficially. So I think that demonstrates the efficacy of it. The recent New York pilot has saved over 900 lives. So there's a real opportunity to make a big impact here if we go forward with it.
And you're right to mention, of course, this is really trying to stop overdoses, and that's where you're focusing your attention on. And I want to ask you about whether you're getting support for is it a private member's bill, Paul, that you're bringing forward? I mean, is this something that you're getting support for?
Yeah, there's been broad consensus in the Scottish Parliament across all parties, including from Douglas Ross and the Conservatives and several Conservative MSPs, that they are willing to back it. We've got support from the Minister, Angela Constance. The key test is really to demonstrate legislative competence, so we're going to be investigating that, but we're confident we have a mechanism by which to achieve legislation that is compliant with the devolution settlement, and we think we can press ahead with this without interference from the Home Office. We want to treat it as a public health matter first and foremost, because that's exactly what it is. We've got a dangerously high level of deaths that could be avoided. And there are many other ways to tackle this, particularly around rehabilitation. But the first thing you have to do is keep people alive and establish a relationship. These are people who are really at the margins of society. We were dealing with a particular case with a young girl of 21 years of age. She overdosed twice in our converted ambulance. We were able to reverse those overdoses, but she had been sexually abused in care. She was mistrustful of any authority figures. And it was that very basic level of interaction that built up her confidence to the point where we met her again a couple of weeks ago, and she's now in rehabilitation. She's doing really well, but she thanked us for saving her life, and that makes all the difference. I think it's showing people that we care about them, we value their lives. We want to try and build a relationship that respects them and doesn't judge them and doesn't set tests that they're doomed to fail. I think that's exactly what we need to be doing to try and make a difference here.